When choosing a stomacite for a very thin person, you want to identify the outer border of the rectus muscle by having them perform a cough or an abdominal crunch while lying down. You also want to clearly identify their iliac crests and their lower rib cage. Then have them sit up and observe where the mark goes. Pay close attention to the horizontal creases that extend laterally from the navel. Move the site as needed to the apex of the infraumbilical roll to avoid the crease. This crease can lead to frequent pouch leaks. Have the patient stand and check the site again. When choosing a stomacite for someone who has a moderate amount of abdominal adipose tissue, you want to identify the outer border of the rectus muscle by having them perform a cough or an abdominal crunch. Then have them sit up and observe where the mark goes. If it disappears from their field of vision, or the pouch will be compressed between their abdomen and thigh, you will need to consider a higher spot on the abdomen, avoiding the crease from the navel. Make a note of the lower rib cage and pendulous breasts. Have the patient stand and check the site again. The higher the site will likely result in easier stoma management. I have marked this patient's belt line. Mark a spot on the skin of the abdomen that is located within the rectus abdominis muscle in the appropriate quadrant for the planned surgery. Avoid the umbilicus and any creases, scars, or folds. For the purpose of this video, I have chosen to mark all 4 quadrants. When marking a patient with a thick abdominal wall, marks in the upper quadrants may be preferable from a surgical perspective. Have the patient lie on their back and activate their abdominal muscles to assist with identifying the lateral edge of the rectus muscle. Then have the patient stand up and determine if the sites are within their field of vision. This patient reports he cannot see the lower marks. Adjust the placement of the sites as needed. Avoid the lower edge of the rib cage, and in women, consider pendulous breasts. Remove any stray marks with an alcohol pad.